Health officials say it is a record year for cases of Legionnaires' disease. That's the type of severe pneumonia that 5 UW hospital patients were diagnosed with this week, suspected to be caused by hot water system issues. But there are steps you can take to stay safe. Our Madeline O'Neill joins us to explain. Maddie?
Eric, one of those patients was already seriously ill and died this week after being diagnosed with Legionnaires' disease, which is usually seen in people with low immune systems. It's caused by a certain bacteria, which can grow in your home under certain conditions.
It's a record pace, and it's not one that we're proud of.
Legionnaires' disease is more common than you might think.
It's not really rare.
That's according to epidemiologist Thomas Haupt at the Wisconsin Department of Health Services, who says Legionnaires has become more prevalent over the years.
It is potentially 10% fatality rate for those people who come down with it.
In 2010, Wisconsin DHS data shows the state had 63 confirmed cases of the disease. That jumped to 160 in 2013. And now in November of this year, that number is approaching 300.
We've done everything we possibly can to try to identify sources of this.
Haupt says it's hard to trace the source of the disease, which is caused by a certain type of bacteria.
It's frustrating for everyone involved, including the patients and their families.
A hot water system at UW Hospital is the suspected source of 5 recent cases of Legionnaires' disease, which is spread by breathing in the mist of contaminated water. The way that water gets contaminated could be from the pipes in your home.
People probably don't think about the plumbing inside of their home all that often, but it really does impact water quality.
Madison Water Utilities' Amy Barrios says water going into homes and businesses is disinfected, but stagnant warm water in plumbing systems runs the risk of growing bacteria like Legionnaires.
Especially if you have one of those, extra bathrooms or something somewhere, just use that water in there, because when you turn on the tap after a couple months, that water's been sitting in that tap for a couple of months.
Why the disease is becoming more common nationwide is still unclear.
We're doing everything we possibly can. We're keeping an eye on things. It's just been an unexplainable year for Legionnaires' disease.
Haupt says the fact that UW hadn't had any hospital-acquired cases of the disease in 23 years before this week is a good track record, and there's no further risk to the public at this point. Now, with that being said, if you or a loved one were in the hospital for an extended period of time and came out with pneumonia, it is worth getting checked out.
Madeline O'Neill in our news center tonight. Maddie, thank you.